Okay, welcome back, everybody. Our last session for the day. Thank you for sticking with us to the very end. And we have an incredible panel for you and a very, very important policy discussion. So first, let me introduce the moderator for our panel, Laura Stock. Laura Stock is the director of the Labor Occupational Health Program here at the Center for Occupational Environmental Health, and a outreach member and head of community engagement for the California Labor Laboratory. That's a lot of things to say all in one string. She directs and administers the Labor Occupational Health programs, providing training, research support, materials development, and technical assistance for workers, employers, health professionals, and the general public. She also provides direction to staff on translating research findings to practice and to public policy. In her over 30 years at LOHP, she has developed various training programs and educational materials on occupational safety and health issues, and has provided technical assistance and consultation to workers, unions, employers, policymakers, and others on how to set up effective health and safety programs. Let me turn it over to Laura.
Thank you so much, Christina, and happy to be here with a great panel. We've now arrived full circle from our opening session with Julie Sue and Lorena Gonzalez Fletcher, who laid the groundwork for this conference, looking at working conditions in a range of occupations, including fast food, ride-share drivers, day laborers, et cetera, and highlighting some of the policy initiatives needed. And over the last 2 days, we've heard about a range of serious problems, from misclassification, violence and bullying in the workplace, low wages, retaliation against workers, safety and health hazards, including workplace stress from workplace issues, and the impact of the fissured workplace, which we just heard about from our last speaker. So today, we want to pick up on some of that discussion and focus on the kinds of policy and advocacy strategies we need to address these issues and ensure safe, dignified, and just work, as we've just discussed. And so we're going to be looking at this in 3 buckets. The first is legislative initiatives, and we're hoping that Assemblywoman Liz Ortega will be speaking to this. I'll be introducing her in a moment. We're going to be looking at strategies associated with regulatory changes and getting improved LOHP regulations. And we have Dr. Robert Harrison from the California Department of Public Health, who will be talking about an effort to pass a regulation addressing silica and engineered stone. And then finally, we will talk about union advocacy, and we're happy to have Elmer Lizardi, who's a legislative advocate for the California Labor Federation. As I mentioned, we're really excited that we have Assemblywoman Liz Ortega with us. Welcome. And she's only able to be with us for a limited time. So before I introduce the other panelists, I'm going to give a little bit more of an introduction to Assemblywoman Ortega, and then give her some time to discuss some of the initiatives she's been working on. So she represents District 20, one of the most ethnically diverse districts in the state, which includes Hayward, San Leandro, most of Union City, and parts of Dublin and Pleasanton, as well as a few other communities. She is a longtime labor leader and activist from an immigrant family who dedicated her career to fighting for working class people of Alameda County. Her undocumented mother brought 3-year-old Liz and her family to California to build a better life. And that struggle shaped the values that guide her work. As statewide political director for AFSCME Local 3299, the University of California's largest employee union, she secured passage of state legislation to maintain and protect essential service jobs at every UC campus. as the first Latina to be elected Executive Secretary Treasurer of the Alameda Labor Council. She's been a leader in the fight for equitable wages, health care, and safe and secure jobs. And we've been thrilled to have Assemblywoman Ortega now in the State House to be able to really lend her considerable wisdom and her advocacy skills to fighting, in her role as a legislator. So welcome. Thank you so much for joining us. And we'd love to hear about some of what you see as the key issues, what's needed to improve working conditions for workers in California, and what you've been working on now. Thank you. I'll turn it over to you.
Thank you, Laura. Thank you for having me, everyone. It really, whenever I get an opportunity to talk on panels like this and see familiar faces, it feels like being home. As you mentioned, I've spent over 20 years working in the labor movement and really focusing in on, organizing and representing workers, and excited to be here as not just your assembly member, but also the new labor and employment chair. And having the honor and privilege of representing, over 2 million workers who are unionized, but also more than 19 million who are not. And really being able to, give that voice to all of those workers since headed to, getting to the assembly. Some of the things that I've really been focusing on are things like empowering young workers. One of the first pieces of legislation that I worked on in collaboration with the state Fed was making sure that our youth know about their rights in the workplace. Since getting here, I learned more and more about youth whose rights were being violated when they entered the workplace. And having been a young worker myself, starting working when I was 15 years old, I really recognized and saw the need for something where we were educating our youth about some of the legislations that we worked very hard to pass. In California, we have some of the most some of the best pieces of law protecting workers, but they don't do any good if our youth don't know about them, particularly when it comes to health and safety, overtime, and sexual harassment. We had a number of young women to come and testify during our hearings to talk about the things that they didn't even know were illegal, and now are able to learn about those things as they enter the workplace. But in addition to knowing the laws, they also will learn about organizing a union themselves. We saw a hot labor summer last year, and we saw an uptake in organizing among Starbucks workers, many of them who are youth, and now being able to take that information when they enter the workplace was critical. And excited that it was passed and signed by the governor, implemented across our educational system here in California, but also now being looked at in the state of New York, and possibly being duplicated and being done there as well. In addition to that, I've been thinking a lot about, I mentioned, having some of the most advanced and important pieces of legislation here in California that we've worked on over the years, but none of that is any good if we're not implementing them. And in one of my first hearings related to farm workers, it became very apparent that we still have a lot of work to do when it comes to, once we get things done here in the legislature and we celebrate the passage of things, making sure that they're actually being implemented on the ground. And a lot more work needs to happen there. And so really, what is my role in making sure that that's occurring, and working with, our labor unions, but also thinking about all those unrepresented workers and making sure that those laws are being implemented on the ground. And we're looking at departments like OSHA to making sure that it's not just the resources, but, what are we doing? What is the follow-up? Because we can pass all these laws, increase minimum wage, heat regulations, health and safety, but they're not doing anyone any good if they're just sitting on a shelf. And so that is something that I'm going to be working on and putting a spotlight on, and hopefully working with partners to continuing those efforts. In addition to that, really working at educating more around knowing your rights. A lot of workers tell me they don't know what they don't know. And so, making sure that we continue that education outside of the Capitol and in the workplace and on the ground is part of my overall big picture package this year, and hopefully we'll continue to do more of that. So I said a lot. I'm trying to condense the work. I also plan on being here for many years to come and continue to do more work to give more workers a voice in the workplace. So I will stop there, and thanks again for inviting me.
Yes, thank you so much for both joining us and for the incredible work you've been doing. And I did have a question that I wanted to ask. It's important what you've highlighted, that as you say, California has been in the forefront of passing really protective laws and regulations, which we'll talk about in a few minutes. But they don't matter if there's not the resources to enforce them on the ground. And I know you have definitely been taking a leading role in shining a spotlight on that, and holding a hearing to look specifically at issues around understaffing and under-resourcing at LOHP. And I wonder if you could tell us just a little bit more about that, and any particular takeaways you got, or any sort of, calls for action you might have based on what you've heard.
I mean, I held one hearing, and was really, in my opening statements, I made it very clear that I didn't want to hear any more excuses and it wasn't putting blame on any one particular department, but in our state overall, and how we don't prioritize workers. We just came out of a budget in which we had more money than we knew what to do with. And the issue of short staffing was still being brought up. And in my point of view, it was about, prioritizing what we're putting how we're prioritizing or not. If we're able to save a bank in less than 72 hours in the state of California, why can't we not look at saving lives of people who are dying in the workplace? And really toning in on what we need to do to hold departments accountable, but also ourselves, and making sure that we are prioritizing the health and safety of all workers across the state. And that includes how we diverse our resources. And so I'm looking into that more, and there's more to come on that.
And do you have any particular, thinking about, we have a diverse audience listening to this conference, both people who are involved in researching and advocates on the ground and public health workers. And do you have any particular sort of call for action of what you see is needed to address some of these issues? Are there any particular areas that you think more data is needed, or where you're looking for more support around future advocacy initiatives? So is there any?
I'm looking right now in terms of the hearing that I had in next steps. I am going to be looking at an audit. And again, I'm not looking at the vacancy rates, but looking more about, it's a really difficult process just to get an investigation going. So looking at, okay, if you're lucky enough to be one of those workers who gets an investigation open, and you get to the top of that, and you get some kind of a negotiation, what are we getting? What are the workers getting in terms of the fines, and what are they settling for? And really honing in on that piece is what I'm looking for. I'm also looking at, I mentioned at the beginning around our youth, and I'm seeing a lot more cases of youth, underage youth working in spaces that they shouldn't be. Many are immigrant, and having a lot of audits that take place, and a lot of investigations that happen during the 9 to 5 hours. And so really looking in on what's happening with our youth workforce, and some of the reporting that's been coming out And unfortunately, we're not talking about other states and poultry factories or, other factories in other places of the country where we're saying, oh my God, how could this be happening in Texas or Florida? This is happening right here in the state of California. And that's another issue that I'm really diving into.
Yes, and thank you. As you mentioned, you've been a great leader in the recent passage of AB 800, as you mentioned, which is the law that now requires that youth in high schools will be given information about workers' rights, health and safety, and other things to really strengthen their ability to address those issues. So I know your time is very limited. I wanted to thank you so much for joining us, and we really appreciate the leadership and advocacy that you have done for workers throughout the state of California. So thank you very much, and I know you need to sign off. So
Yeah, thank you so much for having me.
thank you. So thank you. So with that, I wanted to just, as I said, I'm co-facilitating this session with Victor Rubin, who I think many of you have met. He's been a consultant for the California policy, on policy for the California Labor Lab. He will be helping to facilitate this session. And as I mentioned, we're going to turn now to two additional pillars of the kinds of strategies we can use: regulatory with the Standards Board, and we'll be Victor will be introducing Bob Harrison in a little bit more detail in a moment. I will say that we'll be looking at how we can work with the regulatory structure, and particularly in California and CalOHP. I'll mention that I am also a member of the CalOHP Standards Board and look forward to chiming in a little bit after Dr. Harrison speaks with a little bit of my own perspective of what it takes to get change at that level. And then we're going to be looking forward to hearing from Elmer Lizardi, who will be talking further about both the strategies and the initiatives that the California Labor Federation is spearheading in the coming year. But I think I'm going to now turn it over to Victor to introduce Bob Harrison, and then we'll pick it up again after that. So Victor.
Thank you, Laura. And welcome everybody to this last session. Yes, we've always said since the inception of the California Labor Lab that legislation, regulations, and advocacy were all pillars of the policy process that we wanted to understand and enable in as many positive ways as we could. And now that we're a couple years into it, we realize that there's a perfect case study, a perfect example to spend a little time with about the development of new regulations in a critically important area. The California Artificial Stone and Silicosis Project, which has been a project of the State Department of Public Health, but also supported by the California Labor Lab, and has leadership, many of whom are both in UCSF and at the State Department of Public Health, has been able to not only create an impressive and formidable body of clinical research and epidemiological findings, but then to move with great alacrity and effectiveness into the realm of policymaking and regulation. And we're going to step back and take a look at that a little in the next few minutes. Silicosis is a terrible lung disease, pulmonary disease caused by, in this case, the conditions of cutting artificial stone or engineered stone, particularly in unsafe and dry conditions. And it had largely been under the radar. Most of the work is done in small shops. Many of the workers are undocumented, and many of the cases had not been tracked as well as they could be. But recently, Dr. Harrison, who I'll introduce in a moment, and his colleagues, who are clinicians in the field, who are at the State Department of Health and are at UCSF, have been able to pull all that information together. And as Laura is going to elaborate later, as well as probably Dr. Harrison, it's the workers themselves, the patients themselves, who have spoken up and become a key part of all this. So we're going to see what happens when that kind of urgent issue gets the kind of attention it needs, first from clinicians, then from researchers, and now in the policy process. So I'd like to welcome Bob Harrison. Robert Harrison, MD, MPH, is chief of the Occupational Health Surveillance and Evaluation Program in the Occupational Health Branch of the California Department of Public Health, and if that were not enough, clinical professor of medicine at the University of California, San Francisco. And you get that all on one business card or two different business cards? It reflects that he's been at UCSF since 1984 and has diagnosed and treated thousands of patients with work and environmental induced diseases and injuries. He's also directs the worker tracking and investigation program for the State Department of Public Health. And it's that, as I mentioned, it's that intersection of the university and the state, which is true not only for Dr. Harrison, but for his colleagues on this project as well, and which I think has been a key part of its effectiveness. So, Bob, I'd love you to just give our participants an understanding of how the CAS project evolved to the point where you could have recommendations for regulations to protect workers and get that moving through the policy process.
Victor, thank you for that terrific introduction and the empathy that I feel like you had in that introduction, which I have every day for the workers afflicted with silicosis. This starts with a couple of workers at one company in Southern California and in the Bay Area who are fabricating, cutting, sanding our countertops that we then install in our kitchens. It's called artificial stone. We used to use marble and granite, but this artificial engineered stone, which has over 95% silica dust, is pretty much the product of choice that we'll buy if we go into a big box store or a tile showroom, anywhere we go in California. And, you know, as consumers, this countertop comes in its final form, but the workers who are making this, fabricating it, cutting out the sink patterns and cutting it to the shape that we need, are working many in really dusty shops that are in warehouse areas in our towns and cities. They're almost all immigrants, most Hispanic, largely from Mexico, El Salvador, Guatemala, that are coming across and taking these jobs. They're really pretty highly skilled because, you know, you have those countertops that are cut to exact shape and sizes, and they're non-union. So, you know, from the point of view of everything we've heard over the last couple of days, they fit all those categories that we've talked about. Most of them have no health benefits, are uninsured or insured through Medi-Cal. So if they get sick with silicosis, almost none file for workers' compensation benefits. And when they go to the doctor, they go to our public clinics and hospitals. If they need lung transplants, which now about 15 or 16 have either had a lung transplant or are eligible or waiting on the waiting list, that's a couple of $1 million that's being paid for by Medi-Cal, not by workers' compensation insurance, which many of them are entitled to, but for a whole host of reasons don't file. And some are in the informal sector who are really, in my view, working with an employee-employer relationship, but are called independent contractors. And so if you're an independent contractor, you can't file for workers' compensation. You're self-employed. So this problem emerged about 2 decades ago in Israel. And everywhere this product has gone around the world, it's caused an epidemic of silicosis. Israel, Spain, Australia, and now California, where we have a total of 132 cases at last count. And so this is as an entirely preventable problem. The real policy challenge here is, what do we do about a preventable disease like this? I want to share with you my recipe. So, this is my secret sauce. It has 5 parts to it. And there might be more, but this is like my, my experience. Call it grandma's recipe, whatever you want to call it. The first part 1, is the people, the story, the person that's affected, or the people affected by silicosis. Laura, I think you're going to touch on this after me as a member of the Standards Board and the impact that had at a hearing last August. And I think it's imperative that we have a way to identify, however it is, whether it's outreach or education or doctor visits. My own personal experience, I treat workers with silicosis, and I've stood in the small kitchen of an immigrant who lost had a brother who lost 2 brothers who died of silicosis, and I was standing there in his apartment telling the father from Guatemala that both of his sons died of silicosis. And that's what I take with me, because I can never forget that story. And those workers are absolutely key. So having a way that we can bring those stories to light. The second part, so that's part 1, mix that with equal parts data. So we have a count, we know where they are. We are tracking those numbers. We're bringing that out through research. We published a paper in the Journal of the American Medical Association in August of 2023. And that paper was published to a primary care audience. So general practitioners, because those are the people who actually see workers with occupational disease first. Unfortunately, many of them don't recognize it and they misdiagnose it. And they, as I say to primary care providers, if you see something, say something. But often they'll see something and they don't say something. So that's the second part of this secret formula, is 1 part worker, 1 part data. The third is public health campaign at a community level. So for this, Los Angeles County deserves, a huge shout out, because their local health department has really taken the lead in reaching out and working with community organizations, Pacoima Beautiful and now Adepska in LA County, that have not traditionally or typically focused on worker safety and health issues, but with some local funding have done street level outreach campaigns directly into small businesses with worker and employer education. The fourth ingredient is enforcement. And Laura, you'll probably talk a little bit more about this, but a petition was sent to the California Occupational Safety and Health Standards Board for an emergency standard that toughen up the regulations in these countertop fabrication shops, build on an existing silica standard, but make it much easier for Cal/OSHA to enforce this if they see something that's been cut dry, which is an absolute, never want to cut this stuff dry. Silica dust goes everywhere, that those shops can be immediately shut down. And so it gives Cal/OSHA a bigger tool, a bigger stick to enforce. And that was passed in August. The petition was granted in August, and then the standard went into effect in January. So Cal/OSHA is using that enforcement tool. And the fifth secret ingredient is structural, or what I call structural or policy change. So this is what I call the global capitalist problem, okay? This is manufacturers from around the world. They have this product that they sell everywhere. California is a huge market. and it's fabricated by small shops. So how can we regulate what is the Wild West of a marketplace? For that, I think it requires legislation. It's a structural solution that gets at the supply chain. Assemblywoman Rivas has introduced a bill in January, supported by California State Labor Fed, thank you. That has some really important policy pieces that cannot be addressed strictly by enforcement. It has a supply chain accountability to the fabricators in these shops to create a certification system, much like we have for asbestos and lead, that you just can't open up a shop, put out a shingle, and not be certified. And it also has language in there about apprenticeship and prevailing wage, so that it can really rise everybody up from this industry that has a fair amount of cash-only underground economy. So those are my 5 ingredients. I'm pretty darn optimistic, actually, that between all of those, we're going to do something in California. It's not going to happen right away. These cases are going to keep on rising because the exposures have happened over the last 10 years. But I think we're going to be able to tackle this. Thank you.
Thank you, Dr. Harrison. We'll come back to as many of those 5 points as we can, but let's jump right back to the first one. And Laura, as a member of the OSHA Labor Standards Board, can you tell us a little about what it was like to hear about the problem and the possibilities for addressing it in that context?
Yes, thanks, Victor, and thanks, Bob, for that overview. Yeah, when I was appointed to the board, it was after working in the field of occupational health for many, many years. It was really great to be able to have a window into how policy change is made and what actually makes a difference. What does it take to convince people to act one way or another on the board? And in my years on the board, I've had the time to witness over and over again the power and the bravery of workers sharing their personal experiences, often risking retaliation, wage loss from taking time off. And those testimonies, I have seen them move board members to see that protecting workers is more than just balancing, data and economics, but actually is a moral issue. That when it helps people see that supporting workers and making sure that workers are safe is simply the right and only thing to do. And the thing that moves people to be able to look at it in that way is those powerful worker stories. And the hearing on the silica standard was a perfect example of this. Is that that board vote occurred in August, as Bob said, and I think it was unclear before that board meeting where, as we never know, where board members stand and the things that they are weighing and how they're going to be working. And I think there was some sense, not necessarily of optimism, the feeling that in fact this was something that was probably maybe didn't have the support it needed to pass. And there was like powerful testimony from doctors and others and people presenting data, et cetera. But then at a certain point, we had an opportunity to hear from a worker who was suffering from silicosis. He was waiting for a lung transplant, which would be his only chance to survive. And I'm happy to report, I believe, that he received that lung transplant. He was joined by his wife at his side, and he spoke about the impact of this disease on his life and the life of his family, and literally kind of moved the audience to tears. And I feel like that completely shifted the conversation once again to realize that these are real people and that our consequences and our votes have real action. And that going from a vote that we weren't sure was going to pass at all, it passed unanimously. And so I just want to elevate the critical importance of bringing those stories to second what you said, Bob. I also want to say in general, I want to really give a shout out to the many organizations that make it possible for workers to testify, because unlike other other entities and stakeholders who have resources to have people go to every board meeting, to be paid to review things. Workers, unions, worker organizations don't have those resources. So it takes a lot to be able to get people together, to bring them year after year. We saw in many other standards, from workplace violence in healthcare, hotel housekeeping, in heat, et cetera. We saw many organizations, unions and worker organizations, invest a lot of time in making it possible for people to get to, before the pandemic, to be able to travel to Sacramento or to other hearings to testify. Thankfully, since the pandemic, now it's possible to testify remotely, which has greatly increased access for workers, and leveled that playing field of who gets to speak to the board, quite a bit. So I just wanted to share that, and also by that really encourage people to capture their stories and be willing to share them. And it really makes a huge difference in what happens, and laws and regulations that are passed.
Thank
I'll
you.
turn it back over, and I know, and we'll eventually be hearing directly from Elmer to hear a little bit about those efforts. But Victor, I'll turn it back to you if there's other questions or comments you want to make.
Yeah, thank you. Dr. Harrison, if it's been less than a year since the new regulatory standards and have been in place and could be enforced, and then you made it clear that there's a need for legislation and what you call the broader structural response. But in the immediate, in the time we're in now and over the next year or so, are you satisfied with what you've seen in terms of enforcement? I mean, we've been hearing throughout the conference about severe shortages in staffing for compliance and things of that nature. Is the Rivas bill the main focus of your attention and the attention of the advocates at the moment at the state level? Are there other regulatory steps you also want to see taken, or would the legislation cover that?
Victor, good question. So this emergency regulation that gives LOHP a bigger stick, a better enforcement tool, has really just been implemented, became effective in January. So I think it is important for the employer community that there be what's called a level playing field. And this is often a concept in workplace safety and health, right? So if I'm a good company, if I'm investing in good workplace safety and I have a competitor who's not, the market is not fair in that sense. I can't compete. Actually, it's an interesting principle across the board when we talk about worker safety and health. It's often a comment I hear from the employer community. And so that's a role that LOHP is playing right now, is helping to level that playing field. In this particular industry, and I think in most other industries, this is just my personal feeling, enforcement is absolutely critical and necessary. We need a strong OSHA. We need to have an opportunity for workers to file complaints, and a responsive and a resource-rich OSHA. But for most problems, if not for all, enforcement alone doesn't solve this from a policy perspective. That's been my experience, that when a marketplace is so dysfunctional and exposes workers to these hazards, we need broader policy solutions.
Do you have any comments? Some information about Australia has been put in the chat, and I know we've talked about Australia's ban, if I'm not mischaracterizing it, on this practice. Any comments on that, or whether it's a guide for what we might do here?
Australia banned artificial stone. It's going to be effective at the end of at the end of June, actually. They did it in December. And the Australian consumers, best I could tell, they sort of shrugged and said, okay, I can't buy artificial stone anymore in Australia. I'm going to buy other products. As I put in the chat, it's a very interesting and deep conversation, I think, about that concept in the United States. We have rarely banned anything in the United States.
Mm-hmm.
The US EPA just banned methylene chloride a really highly toxic chemical that I worked on for over a decade. They finally banned it about 2 weeks ago from pretty much all use. It's a paint stripper with a safe alternative.
Hmm.
Asbestos is another example that just came out about 6 months ago. So the marketplace of goods that we want to have at either at our doorstep or to be able to purchase in a big box store in America, it is really, really tough. I think we should have a whole conference about it. You want to know my truthful opinion, because it's a very important question. Could we ban artificial? I mean, even if that was the right policy solution, do we have the regulatory authority? Do we have the political will to do that?
A good question.
It's a good question. We are not Australia.
Nope. We're not Australia, we're not Canada, we're not
Exactly.
countries with a different set of premises.
Yeah.
Just very briefly, because we also are now starting to get a couple more questions in the chat, and we have about 3-4 more minutes for this segment. Speaking of national policy, Senator Alex Padilla has taken an interest in the project, and his staff, we had a briefing with them a month or so ago. And not coincidentally, Pacoima is the senator's hometown. And I think that added to his interest in that of his staff. Is there any way you want to characterize what you would want the Senate or the senator or the federal government to be thinking of at this point? And, if there's anything more local, other than, obviously Pacoima is in LA County and that's the jurisdiction of record, but I was struck by how at some level everything is local. On the other hand, it is important to get a federal perspective. Anything coming out of that experience with the senator or that you see as an open door?
Federal LOHP launched a national, what's called the National Emphasis Program. They're inspecting probably 100 to 200 of these shops around the country. I am often asked, is this just a problem in California? Why do we have 132 cases in California and there's one case in Florida that I'm aware of? One case I just became aware of in Chicago. Couple of cases in Washington State. Where are the other cases? I think they're there. I argue that, the countertops are the same in Phoenix as they are in Los Angeles. And the shops are the same, but they have not surfaced. And I think that's a function of awareness, doctor awareness, healthcare provider awareness, and access to care, and all the obstacles for these folks to come out of the shadows. So Federal OSHA has launched an inspection program, and I think I anticipate that they're going to find that these shops are as dusty around the country as they are in LA. And at that point, I think it would be very useful to have some national attention on the question. And this is where I think California plays a really important role, because the solutions we come up with in California are going to be the focus of attention at the national level. It's often the case, I think, for a lot of worker and environmental regulation.
Yes, thank you.
But I think we need that data, Victor. We're going to need to have that information, because we need to say it's as dusty in Phoenix as it is in Los Angeles. I can't imagine it's not.
I'm going to very quickly refer to 2 comments that are in the Q&A, since not everyone can see that. And then we're going to move to Elmer. And Elmer, you've been very patient, and you might even want to weigh in on this particular topic before we get to more generally, but hang on just for a second here. One Q&A is more of a comment. It says, one thing that the public health community can contribute to standard enforcement in California is to promote and produce industrial hygiene and university programs and hiring priorities, since industrial hygiene is critical for effective enforcement. Let's push NIOSH to increase its support for industrial hygiene programs so that Berkeley and UCLA can lead the way. It's a comment rather than a question, but you're nodding, so I assume you're in general agreement with that.
I
And then
tell
the
all my
other-
students, industrial hygiene is the best field. It's a secret field. If you're going to get a master's, go get a master's in industrial hygiene.
You heard it here. The final thing also about OSHA, the writer says, when I have tried to follow OSHA's guidelines, I was encouraged to send an email and have yet not gotten an actual response. And therefore, I shifted my focus to science support with PTSD Family Coach app with direct feedback. How do we develop OSHA's science? I know, like, I'm not sure I fully understand the context, but if you do have a response, if that triggers anything that you can suggest, we'd be most grateful.
Hey, Laura, you want to answer that?
Well, I mean, I will, a couple of things I wanted to say. I don't know how germane it is to that. One thing I did want to mention on the silica standard, and then I do want to move to introduce Elmer so we can bring him into the conversation. But I wanted to say that a week from tomorrow, there is a standards board meeting, and the board will be voting to extend and to continue the emergency silica regulation. So I just want to again highlight that the standard board has meetings every month. Their agenda is publicly posted, and it's really important for people who care about the outcome of the things that are in front of the board to speak up. So there'll be an opportunity next week. And then there's many other things coming up that are really, really important, from indoor heat to infection control. And there's a lot of issues that are kind of on the agenda, and I encourage people to look out for it. And relative to the previous comment, I think it speaks to the general lack of resources for OSHA that, I think as many people have been saying, that, I'm proud to have been part of this board to vote on these really important regulations, but they're not worth the paper that they're written on if there's not strong enforcement. And I think a lot of people have been talking about that issue, and both, the opportunity to both enforce as well as do the research and to gather the science and to be more responsive. That's an ongoing problem. But it's kind of a good segue, if I may, now to introduce Elmer Lizardi, who, along with the California Labor Federation, has been really thinking about a lot of these issues and how they can be sure that protections are both passed and enforced. So let me tell you a little bit about Elmer. He's a Mexican immigrant who grew up in the California Delta among farm worker communities who mostly farmed pears and grapes. He attended UCLA, where he attained a BA in political science, a minor in Chicano studies. And after graduating from UCLA in 2020, he was accepted into the California Senate Fellows Program to work on government and policy in the state capitol. He worked in the offices of Senator Ben Hueso and then Senator Nancy Skinner, mainly focusing on energy, environmental, and natural resources policy. And after 3 years in the California State Senate as a legislative aide, he accepted an opportunity with the California Labor Fed to focus on his true passion, labor advocacy policy, and advocating for workers. As a legislative advocate for the California Labor Fed, he helps advocate for over 2 million union members at the state level, with a special emphasis on labor law compliance and worker health and safety. And as a son of immigrant farm workers, he always grounds his work with personal experience, and he works daily to be able to advocate for better labor protections, job quality, and access to quality jobs for every Californian. And I've recently met Elmer. He's relatively new in his position, and it's been a pleasure to get to know you. And I've already seen the great job you're doing in mobilizing workers and in speaking out for what is needed. So glad you could join us on this panel, and look forward to hearing about what some of the Labor Fed initiatives and what you'll be working on. So Elmer, I'll turn it over to you.
Wow, thank you for that very generous introduction, Laura. I appreciate it. Yeah, thank you all for tuning in and allowing me to be a part of this incredible panel. I guess I can skip my introduction since that's kind of already been covered. But, as a ledge advocate with the California Labor Federation, most of my work does comprise of collaborating with union and other advocates to pass laws at the state level that strengthen workers' rights. You know, the Labor Federation works on campaigns that help all workers in California, right? We've been instrumental in fighting for things like healthcare reform, obviously increases to health and safety, and increases to the minimum wage, for example. This year, the Labor Federation has an extensive legislative package that we're working on to tackle issues ranging from AI and technology and how it is currently affecting workers, especially how it is changing core job functions of workers or eliminating jobs altogether, to making sure that we are also maximizing public dollars by investing them in high quality, safe, middle-class jobs for workers, and also prioritizing making striking workers eligible for unemployment insurance benefits, to name a few. I don't want to go into every single bill that we have, but I can make sure to share a link to our full list of LEHP priorities for those who are interested, so that you can be well aware of the bills that we're working on this year. I promise we didn't coordinate on this, but one of the main other aspects of my job that I've been loving working on is worker health and safety, especially prioritizing the monitoring of the many agencies and boards that oversee labor law compliance or worker health and safety regulations, especially the LOHP example that has been brought up several times already on the panel. And one of our big priorities this year that I've had the privilege to work on now is the indoor heat standard. And I want to focus on that today because I think it's the perfect example of how we can kind of model our advocacy as well as kind of learn from mistakes as well to make sure that we're more successful as worker advocates in the future. For anyone who is maybe unfamiliar with the indoor heat standard, I'll give a little bit of background and kind of, get us up to speed, and then we can kind of continue the discussion from there. But essentially back in 2016, there was a bill that was introduced and passed in the legislature. It was SB 1167 by then Senator Mendoza, which was intended to protect workers from indoor heat by mandating that the LOHP board review and adopt a standard that would minimize heat-related illness and injury by January of 2019. And that 2019 date is critical to the discussion because there's been several delays since then. The LOHP Advisory Committee actually started working on a standard back in 2017, and they took a lot of employer and worker input into account to try to draft a rule by that 2019 deadline, and to start a formal rulemaking process. But before any official vote could happen, the rule triggered a requirement in state law for an economic impact study, because state agencies that are looking at a proposal like this, they have to conduct what is called a standardized regulatory impact assessment whenever a proposal has a cost estimate of $50 million or more. So that the indoor heat standard triggered this economic impact study. And then because of the study and unfortunately the COVID-19 pandemic, further delays led to an instance in which a formal rulemaking process did not actually begin for the indoor heat standard until March of 2023 and last year, right? Because there needed to be, increased and detailed consultations with other agencies. Now, throughout that entire process, the California Labor Federation and a lot of our worker advocates with whom we cooperated with tried to pass legislation that would actually exempt worker health and safety regulations from the SORIA economic impact studies, because we have seen how often these economic impact studies simply slow down the process, and they end up harming workers in the process because they're the ones who actually have to wait for these safety regulations to be implemented, and they're the ones who end up being harmed in the process. There was bills that the Labor Fed worked on both in 2017 and 2021 to try to accomplish this task, this goal, excuse me, and unfortunately both of those bills died. So, that brings us, now to this year, where in March 21st of 2024, the Cal LOHP board was finally actually set to vote to approve a heat illness prevention in indoor places of employment standard. And mind you, what was included in the standard were basic protections for workers. And what I mean by that is, access to cool down areas, access to cool drinking water, making sure that workers were being acclimatized to new work that introduced them or forced them to be in very hot spaces indoors. And the day of the meeting, the board was informed, or the board informed everyone that the indoor heat standard was actually going to be removed from the agenda because of the administration and the Department of Finance had learned essentially that there was going to be a new higher cost of implementation. I was present at that board meeting, and so were dozens of worker advocates and actual workers themselves who were taking time out of their days to show up and testify in person, right? That the decision to delay the standard further was a very costly one for them and a lot of their coworkers who couldn't be there that day. And after all that testimony, the board actually ended up voting to approve the standard, despite the order to remove it from the agenda. But because the Department of Finance did not give that final approval, the standard is actually still currently delayed again. And I want to highlight that because obviously it's one of our priorities for the year, and we are still urgently advocating for action on this, and we want to see an indoor heat standard to protect workers implemented by summer. But I think, like I mentioned previously, it's like a perfect example of what we can learn about advocating together, right? Number one, I want to make sure everyone who's tuned in is aware of what is going on and understands that this is the high priority and that we still need to fight for this indoor heat standard. But also, it's been a great reminder that important victories like this take time. Unfortunately, even those that help protect workers. And it is especially these campaigns that are worth fighting for and that demand our tenacity, because it is the workers who end up suffering when delays continue. Like Laura mentioned, I am fairly new to the LaborFed team, but being able to work on these campaigns like passing an indoor heat standard have taught me some very, very critical things about our advocacy work that I think can be applied to everyone and we can all benefit from them. The first thing I want to highlight is just how important it is to build strong and broad coalitions to support your advocacy work. We at the LaborFed are obviously very fortunate that, as mentioned, we have over 1,000 local unions who have great expertise in their specific either issue areas or their industries that we can tap into because they have knowledge about how the workers operate in those spaces, right? But aside from that, it's also critical to tap into other experts. Like Dr. Harrison mentioned, we need data. We need experts in the field, whether it be medical field or environmental advocates as well, to be able to beef up our advocacy and help shape our strategies. And then secondly, persistence and fluidity are both instrumental to our work. Because as mentioned, first of all, victories like this often take time and a lot of effort. So you have to be willing to be persistent in that. But at the same time, even when it feels like things are moving very slowly and being delayed, like with the indoor heat standard, we have to be able to adapt to changes in the environment. Because even when things are being delayed, as we've seen, there can be a lot of shifts in the underlying environment of what is going on, right? So we have to be able to adapt to these changes and to kind of leap over these hurdles that may come. And then finally, and this is maybe even one of the most important ones, is that we cannot underestimate the power of simply showing up. Like Laura mentioned, I had the opportunity to work in the legislature a few years before coming onto the LaborFed. And one of the main things that I really take home every night is that decisions are being made every single day. And if we as advocates do not show up to uplift worker voices, there's absolutely no guarantee that they will be considered. And so it is imperative that people like us who have that privilege of having the time effort or a job that allows us to do that, continue to do so. And I think, before kind of kicking it back for the discussion, it would be unlabor of me if I didn't finish with kind of a call to action for everyone who's tuning in. Please reach out to us, right? Share your expertise with us, join our coalitions, and when you can, show up in person, right? I think that's how we're able to be more effective, whether it be at the regulatory level or when we're speaking with members who are considering whether or not to pass legislation, because it may sound basic, but when we can get more voices in the room, we can be louder advocates for workers, and that is often when we are actually heard. And I think Laura can attest to that as being someone who got to witness the worker voices who were able to, change the minds of people who have to actually vote on these critical matters. So yeah, that's kind of my spiel, and thank you all for having me.
Yeah, thank you so much, Elmer, for an excellent remarks that covered really important issues. I wanted one thing that particularly struck me is, as you say, these struggles are challenging. They take, a long time, in many cases, many years, and it is really challenging to figure out, and they're very inaccessible to many people. And so how do you keep people engaged in that struggle, given those sort of structural problems? And when I say years, I really mean years. We recently passed an update to the lead standard that had been in the work for over 20 years. And all of the examples that I talked about, from workplace violence in healthcare, and there was a regulation we passed on for hotel housekeepers, 5, 6, 7, 12 years of people having to come time and time again, which is very, very difficult, as I mentioned earlier. The one thing that I wanted to say, and then I'm curious your reaction too, it's important as a result to recognize, though it's really critical to bring your voices to the effort to pass laws and regulations. We can't rely on laws and regulations to protect us, both because it takes forever, and also because, as we, many of us have said, that the enforcement agencies are under-resourced and very limited in their ability to take action. And that's why other strategies that really build workplace power in the workplace, obviously where people have unions, they can negotiate provisions into their health and safety contracts. People can form health and safety committees with workers where they really work together to figure out about how to document the hazards that they face, come up with collective strategies about how to speak up to their employer. People who are not in unions can reach out to worker organizations who can help support them and represent them as they try to advocate for the changes that they need. So we definitely need high-level state policies, but we also can't depend on them and have to build more on-the-ground workplace-centered strategies as well. And so I was just curious if you had thoughts on that, and any sort of suggestions from your experience about what that should look like.
Yeah, great points, Laura. And I think kind of just to reemphasize that, because I don't know if I can even state that better than you did, but there's a reason why we at the Labor Fed don't only do legislative policy, right? There's a reason why we have a few prongs to our advocacy, and we have our legislative work. We look over regulation and make sure that there's applicable or proper compliance of laws that are actually passed, right? Because as we talked about, without real compliance, the laws are meaningless. And then there's a reason why we also personally, we also work on elections, and we also work on increasing the amount of workers who are in unions. Because ultimately, there's many approaches to helping workers, and certain strategies work better in different areas. Obviously, ultimately, the person going into work, if they do have a union, they're going to be better protected every single day versus having a law passed that isn't, as we've spoken before, is not being enforced adequately, right? So there's a reason why we at the Labor Fed totally agree with that, because we have multiple prongs to our advocacy, right? And that's critical. And another thing too that I want to touch on, you spoke about kind of the often unfortunate long nature, right, of these victories that take time, and they can be draining too. But kind of the fire that we can kind of keep lighting as an advocate organization is making sure that we do celebrate the victories, whether they be small or large, because sometimes it's those small victories that kind of continue that spark until the next big movement. It is very easy to get down on delays or losses. And ultimately, if we allow those to be the things that we only remember, then workers suffer because we are not there fighting for them the next day, right? So part of that is, you have to remember what has happened in the past, but also have a short memory to remember that, like, hey, you know what? It wasn't so terrible. Just wake up the next day and do it again. So.
Yeah, thank you so much. That's an excellent point. I'm going to make one final comment, and then I'm going to turn it back over to Victor, because if there were more questions and answers that, give you a chance to add. The one thing that I will add, and I know the Labor Fed has taken a leading role in this, is what are the kinds of laws and protections that are needed to facilitate workers' voice in the workplace? And to bring it back to that theme of the conference is the importance of giving workers the space, access, and the power to speak up about the things that are important. Retaliation in the workplace has been a real issue, and there's been a lot of effort by a lot of advocacy organizations, as well as the Labor Fed, to really build in protections for workers who are in a workplace and speak up so that they can join together with others, talk to each other about what their issues are, and raise them with their employers and supervisors without fear of retaliation. So I want to sort of thank Labor Fed and you for your work there, and just recognizing that ability for workers to speak up is foundational, both to understand what the important issues are and what the solutions are, but also to bring that passion and power to advocate for change. So again, thank you so much, Elmer, for your remarks. And Victor, I'm going to turn it over to you right now to see if there's any other questions and answers you want to pose more generally, or anything else you'd like to add.
Thank you. I was mulling over the similarities and the big differences between the indoor air standard discussion and the silicosis and engineered stone situation. One is very, let's say, if not narrowly defined, fairly specific. And the data and research and clinical information pertains to particular industry and easily defined and bounded and identified. Indoor air would seem to be a much broader thing, but at the same time, I'd like you to expand a little on the nature of opposition. Is it purely inertia, and I'm not saying you said that, but if there's literal industry pushback, or this evidence of cost and impact assessment is more than simply analytical, what are the politics of opposition, or what are the industries involved in the industry strategies around it? If you can elaborate a little more on that. Because to say it seems obvious that the problem needs to be addressed and that it would be fairly widespread seems, doesn't explain the level of opposition, or doesn't, to me at least.
Yeah, sure. I appreciate that question, Victor. And I don't necessarily want to, speak on behalf of the opposition or anything like that. I will just say that a majority of the concerns that have been raised are related to cost. And I think, I think the best thing that I can highlight is honestly one of the comments that Laura made previously about how important it is that worker voices help to kind of reorient people into the real conversations, right? It is very easy to get lost in numbers or financial studies when you are not speaking directly to the workers who are actually affected by the inaction of, say, something like passing an indoor heat standard. And I think at the same time, it is frustrating because, as we've seen, thankfully back in 2005, we did pass an outdoor heat standard that helped protect workers outdoors, right? So it clearly can be done. And as we've spoken previously, for us, it is a moral issue, right? And I do think it is unfair when we begin to categorize this discussion as one where we are equating the cost of something like an air conditioner relative to the cost of a human life. So I appreciate the question, Victor, and I think, I mean, that's kind of generally our stance. I don't necessarily want to speak on behalf of the opposition on this topic, but I will say that many of the concerns we've seen are just simply related to cost.
Thank you. No, that's a useful elaboration. While you were speaking, Dr. Harrison was speculating in the chat on the greater possibilities for science and data and evidence to be brought to bear on different kinds of worker health and safety policy issues. Bob, did you want to say something about that? And perhaps it might trigger Elmer's response in a sense of what might be possible or what might be useful?
Victor, I was thinking about how to structure, take some of the lessons about how to for scientists and public health and academic and other partners to learn about how to impact policy. I mean, we're wrapping up here, and I'm often asked, you know, how do we do that? Or how do I get involved? Laura, you're saying, you know, come to a standards board meeting. I used to say that when I was on the board too. And I used to say to people, you know, it's not dry as dust. You think, oh, this is like, you know, why would I ever go to a standards board meeting and tune in and make a comment? And I always said, well, you know, it actually makes a difference. Get involved, get engaged. And so let's just put that in the hopper, maybe for something that we can do as a community for those folks, a workshop or training. That's sort of, you know, I just was putting that in there because, and I also mentioned that journalists to me are part of this mix also, because they're another way that we can have an impact. I work with a number of, or, you know, I've talked to many journalists over the years, and they put out terrific stories sometimes. And it's a way to amplify our message. So that's really what I had put in the chat there, Victor. And you know, Elmer, from your point of view, you're up in Sacramento, right? And you're prowling the halls and, you know, following these bills. And it's probably, I'm guessing to you, having us involved is important, you know, bringing the science, bringing the patients, bringing that perspective.
Yeah, critical, definitely. And thank you for raising that as well, because that point about the journalism is super important as well, especially when, you know, over the last, you know, decade and a half or so, we've seen kind of a decline in really good journalism. I do want to, you know, give a shout out to the great journalists who have reported on the indoor heat standard as this has happened, because it's one of the few ways that we can continue the momentum, right? Point back to the fact that, hey, this is important. Look, you know, people are reporting on it. It's critical that you know what's going on. So I do want to give a shout out there. And then also, just to highlight your point about getting involved, sometimes it can be scary, you know, to go out in front of a board and make a comment, but there are other ways to get involved, other ways to support, sometimes behind the scenes, and people can feel more comfortable doing things that way. So I did drop my email in the chat so that everyone can have it. And like I said, you know, your call to action can be as easy as reaching out to some of us, wanting to get involved a little bit more. Maybe you hear about a bill that you want to learn a little bit more about, or you want to be involved in some way, please connect with us. I know that, you know, we all can be a lot more successful if we're able to share information, share data, and share strategies. So please feel free to reach out whenever you need to.
Thank you. And I guess if there's a broader lesson in all this, it's that the education and opportunity to engage people
I sit out.
can go in all directions. And we've heard today about what we just heard about journalists getting the benefit of getting the opportunity, the time and the resources and the support to cover issues like this, especially when they're going to take a long time. And journalists getting the opportunity to learn how to interpret epidemiological data and medical data and various other, even the economic information in a broader context. We've heard a lot, including from the Assemblywoman, about labor education and having young people understand how this process that we've been talking about works. And we've certainly put on these conferences and the other activities of the Labor Lab with as diverse a range of participants and audiences as we can, because the information flowing in all the directions builds support for the kinds of policy changes we've been talking about. So with that in mind, Laura, any final words or any comments?
I think I'm seeing our hosts in the have signed on. I know we're almost out of time, so I'm just simply going to thank you all for participating. Your remarks were great, and it really helped provide a good context and a guidepost for moving forward. So thank you so much. And I think with that, I'm going to turn it over to Ed and Christina to be able to close out the conference on time.